you were talking earlier about all the people, and Dodd was talking about all the people throughout the course of this project. William, I never will forget the day that, the hot day that you had me with one of those hard hats on in that outside elevator going up there to the top floor while it was being built, and I was ready to go home. It was not like today. It was 171 degrees, and we were high up, and there wasn't a whole lot of protection because you were just kind of hanging out over there. I know you guys were used to it, and you walk on that steel stuff with those hats on and do that stuff all the time. It scared the heck out of me. Actually, it scared more than that. But I got to watch that thing go up. And then we all know that the expansion is going to be able to provide the kind of actual hospital setting and the amenities that match the quality of the people who actually provide that wonderful care here. So it's a great day, and we celebrate. And Dodd also mentioned healthcare in general, and I can't pass up the opportunity to indicate that we have made major strides in two of the most important, probably the two most important areas as far as this administration is concerned, in education and in economic development. And I talk about it so much that now the press starts writing what I'm going to say before I end up saying it. But the one area that we have not been able to address in these first 2 years to the extent we've been able to do it in the other areas is healthcare. Oh, we've done a few things and we've tried to patch here and patch there, but we haven't had the kind of comprehensive approach. Now, the trauma system is important, but it's just really the cornerstone, the anchor, if you will, of the overall total healthcare initiative that we're talking about, that entails not merely just the trauma system, as significant and important as that is. Talk about the UAMS extension in Northwest Arkansas, where we can have even more residents training, more pharmacists, more nurses, more healthcare professionals, so as to provide an even greater number of qualified healthcare delivery people out there taking care of our citizens. Home health. You know, not only if you can take care of people at home in many instances, whether it's in senior care or whether it's in health care, whatever it may be, the more community-based local services you can provide, it's not only usually better patient care. People normally don't just like it better. It's better on the taxpayers because it's less expensive and you're actually delivering care at a lower cost. Now, sometimes you don't have that choice. A residential setting is the most appropriate level, but you need that whole array so that everybody, whether it's AHEX, whether it's home health, whether it's community health centers, mental health, autism, cancer research, all of those things wrapped up into the package, which the press has really done a good job of explaining and sitting out there, can be achieved with a lot of courage. Now, I don't want anyone to think this is easy. A 3/4 vote is nigh on impossible. Chris Thomason's out there. He can tell you he served in the House. A 3/4 vote in each House is hard to get for motherhood and apple pie, much less a tax. So if anybody is wanting to rest and think that this is a completed project, let me disabuse you of that notion, because it will be a terribly hard fight to get it done. It's been done. We did it last year with a severance tax, but it's very difficult to get it done. But it's so important for the future of our people, because healthcare and the quality of life through health initiatives is also an integral part of a quality of life that's founded on improved education and improved economic opportunity for our people, so that they can work and stay here, and their children can stay here, and their grandchildren can stay here. They can choose to keep Arkansas as their home, and we can build a state that we all love through all of those components: education, economic development, and health care. So this is another singular event of a continuing saga of the jewel we call UAMS. It's another selling point for us in so many other areas. You can't imagine how many companies come and look, and one of the questions that the top folks in those decision-making process, some of the top questions they will ask is the status of the healthcare system, the status of the ability to be able to take care of their families and their employees' families. And when that question comes up, we don't take a back seat to anybody. And we are proud to say that UAMS and this continued growth here creates opportunities in so many other areas for the people of our state. And we are very proud of you. Thank you.